This program is made possible by the loyal financial support of the friends and partners of Family Policy Institute.
You are the salt of the earth. You are the light of the world.
Good evening and welcome to Salt and Light. Tonight in studio we're joined by the lovely Gio Fisher and Dr. Rene English-Halderblom. Recently we had the honor of attending a Women's Day event that they helped organize entitled Body, Soul and Spirit. Thank you for joining us tonight, ladies.
Thank you very much.
There are many Women's Day events held annually across our nation. Why for your conference did you choose the theme Health and Wellness?
So the theme Health and Wellness was really something that was conceptualized by our Pastor Karen Mayer, who is the wife of Pastor Wayne Mayer, who runs the His People South Church. And we used the concept of health and wellness to build on previous wellness days, but also build on the realization that being a woman in today's society is more than just ensuring that your spiritual life is in tune. As a woman, you have to ensure that your body is well, and that you have to also ensure that your mind is well. So as a team, we sat and thought about it quite a bit and tried to extract, well, what would bring a woman together in terms of a theme? And that's what brought us to body, soul, mind and spirit.
I think we also wanted to leave them with a bit more than just tea and some entertainment. We wanted to empower them and also just leave them with some knowledge as to how they can better their lifestyles through health and wellness. So, yeah.
Are health and wellness major issues in today's contemporary society?
Gosh, yes it is. Even corporates are coming on board and offering health and wellness days to their employees, because I guess they figure a healthy and happy employee makes for a good worker, I suppose. But that also flows out into our families. Me as a mom, a healthy mom, I'm able to do more for my children and more for my husband. As a father, he can do more with his children, and just it flows out into every area of our lives. So definitely in our society today, it is incredibly important to be both healthy and just to have that sense of wellness. And I guess, you know, we think health and wellness, healthy being in a body, and wellness is what we do with that body, how well we allow that body to live. So it is very important in contemporary society today, yes.
I share a similar view. I think Gio really summed it up very well. And in today's society, women find themselves in the middle of very hectic schedules, whether you're a working mom, whether you're a stay-at-home mom, whether you're a single woman, or whether you're retired, you find yourself in the middle of everything that's instant, everything that's fast, and having to juggle many balls in the air. And so being able to find yourself within that in terms of body, soul and spirit in today's society is very important.
Women face many challenges in South Africa, and how do you think this impacts on the health and wellness of women? I mean, you touched on it a little bit about busy lifestyles.
Yes, from a public health point of view, what our society in South Africa faces, and therefore what our women in society face, is what's called a quadruple burden of disease. So from a health point of view, HIV and AIDS, what is called non-communicable diseases, which really encompasses cardiovascular disease, hypertension, diabetes, cancers. The third one being communicable diseases, which are really infections of all kinds, including TB and diarrhea, that often is responsible for the death of so many of our babies and little children. And the fourth one being injuries and violence. And those are what is causing not only death, but is also causing disability in our nation. And with time, we're finding mental health becoming an issue, suicide, dealing with the challenges that our young people face when they go to school. And from a female perspective, the cancers that they have to contend with are breast cancer, cervical cancer. So from a holistic point of view, it is very important for women to understand what it is that afflict them. And so what we're finding is that as society is transitioning and we're becoming more westernized in our ways, women are living longer, our parents are living longer, our children are healthier, and so juggling often as a woman in your midlife, the aging parent, the children, is something that can really become a burden for women. So,
and then there's not forgetting that we are women, and are we emotional creatures, or should I say beautiful emotional beings, not creatures. But so how often have you heard a woman tell you, oh, when I'm stressed, I eat. When I'm unhappy, I eat. I've just gone through a breakup, I eat. And what do you eat? When I'm stressed, I don't go for a salad. Do you go for a salad? No.
No.
We go for all the junk food. So when we're facing those challenges, what we eat then is terrible. We go for the junk food and all the horrible stuff. So that then directly impacts on the body and the wellness and the health. So for sure, those challenging issues we face all the time as women directly impacts our health and wellness.
Yeah, which then brings me to the question, what are some of the things women can start doing or stop doing to improve their health and wellness overall?
They can stop doing nothing. Is that it? Nothing, and they can start doing something, no matter how small. They can start doing a 15-minute walk every day. And it's not just women. Take your child for a walk. Take your dog for a walk to the park. Husband and wife can go take a walk hand in hand for 15 minutes and just get that, get your heart rate up, and yes, get your heart pumping. And then also at our Wellness Day, we offered the ladies a wonderful goodie bag, and in that goodie bag we gave them vouchers for Virgin Active, for Curves Gym, for G Square, Zumba Studio, and so basically we tried to give them the tools that could help them to better their lifestyle. And of course that goes along with eating healthier. And I know it's a challenge for me to stay healthy. It's a challenge for me to eat the right thing. So we have to just take those steps, like one step at a time, one day at a time. I joked with him at the event and I said, I'm a Monday dieter. On Monday I diet, on Tuesday it's done. How many women go through that? I make a joke of it, but it's a very serious thing because we kind of don't stick to what we start. And if we can just do that, I think it will really help in our fight for health and wellness in our own lives. Eh?
Absolutely. Yes, I think that there are many things that women should stop doing and starting, but I agree completely with Gio when she says women should really stop doing nothing. And for me, a very important part of starting to do something is knowledge and empowerment and understanding issues around it. So we broke our day up into health and wellness, and health being knowing your numbers, knowing what your blood pressure is, what are your glucose levels. Have you done a breast screen recently to see whether you have a lump in your breast? Have you gone for a mammogram? Have you had a pap smear? Have you had an HIV test? And those are the things that start the journey towards knowing what your status is and who you are as a woman and what your health is. I also think it's very important for people to understand how various diseases originate and how it starts in one's body. For women to understand what their risk factors are. So, for example, if you weigh a certain weight, for example, if your abdominal circumference is a certain width, those are risk factors. If you don't walk and don't exercise, if you're a smoker, if you eat poorly, those are the risk factors. And therefore, women should understand what are my risk factors, understand how those risk factors can result in some kind of disease or chronic disease, and start taking action and start taking responsibility and start eating properly and start understanding what it is they must eat, why they must eat. But that can sound quite complicated, and really a very simplified way is to just start moving, start walking, get a club together, get your girls friends to start walking with you, reading, asking the right questions. And I believe that in every church, for example, there are women who are medically trained, there are women who have health and wellness backgrounds, and it really is as simple as just asking somebody, explain to me, how does this develop, how does that condition develop, how can I prevent it? The other important thing about starting to empower yourself and starting to ensure that you build up your knowledge base around conditions is so that you can understand what the issues are in your community, so that we as the church collectively can start taking responsibility for what I referred to earlier, the quadruple burden of disease. Yes. How can we start shifting things on the ground? And so it's about taking individual responsibility and collective responsibility.
And isn't it really getting down to the basics? It's just getting back to the basics. Sleeping well at night, making sure you get enough hours of sleep at night, eating healthy, and then exercising. I think we forget about the basics, and it's the basics that are so important. And if we just kind of slow down a bit and get back to that. I think it's a start in the right direction.
Thank you so much for joining us this evening in studio, and for the ladies that we spoke to at the event. It was such a pleasure being a part of it, and for educating us on why it's so important to take care of our body, soul and spirit.
Thank you, Tara.
I'm speaking to Carden Meyer, who's the pastor of His People Church in Cape Town. Carden, you not only are you a runner, you're involved with the Women's Day today, but you're also the pastor and in ministry. Can you tell us something a little bit why you think that women's events like this is important? Why you focus this specific event on health and women?
Yeah, I think women, firstly, I'm a woman, and so you kind of just identify with that and just know your own basic needs and what you feel is important and or where you neglect yourself, and so just to build on that, and so the reason for the Wellness Day especially is just a real focus on women, a real focus on just getting away from that busyness and taking time for yourself and actually look after your health, your body. We've called it body, soul and spirit, and so we're really looking at the whole woman, just really building her up.
You're not only a mom and a wife, but also a pastor of a church, and so as a pastor, you know that community is important. And how do you think we need to build up women in society and through our church?
That's such a good question, and I think that's such a vital part that we do play as being the hands and feet of Jesus, and just being the body of Christ and what He's called us to do. And so yes, just reaching out to the women. This is just an opportunity as well, just to reach out in the community, to touch the lives of the women, to see their needs met, like I said earlier, but really reaching out there and hearing their cries sometimes. I don't think that we sometimes take the time, and so for me it's true. This is just one little aspect, but then in the community as well, we have our small groups which reach out to draw the women in, to love on them, and to really just meet even sometimes basic needs like finances and just really encourage them, because sometimes that's all they really need.
Thank you so much.
It's a pleasure.
Cherubim and seraphim ahlale kubabaza uyingcwele uyinkosi yezulu uphakeme kakhulu cherubim and seraphim ahlale ekubabaza bayete bayete, 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 bayete.
Genevieve, as a physiotherapist, obviously we know that your main concern is, or area of focus is health and wellness, but also body and spirit is, body, mind, and spirit is part of the focus of the Women's Day today. Why do you think all of that as a whole is important?
Well, if you think about it, you're a physical being, you're an emotional being. So, and as we've heard today, a lot of these diseases are lifestyle diseases, and it's important then for us to move physically, but that also gives us a sense of achievement, and in that gives us some also feeds our spirit.
Yeah, and it's important to stay healthy and to take care of your body. Like you mentioned, you did a few demonstrations. You want to tell us a little bit more about the physical therapy part of it?
Well, today was really just was a small portion of what we do as physios. And I really just wanted to encourage the ladies who, I'm sure most of them sit behind a desk all the time. And it was really just to show them how to take care of that. And also it could also be a bit of a stress reliever as well.
Juanita, so you work in the public health sector, and you spoke at the event today. I just wanted you to maybe expand a little bit more about what you experience in the public health sector with particular reference to women.
I think in the public health sector, the biggest challenge we have is that women who access our services often are not empowered to make the choices they would like to make, mainly due to socioeconomic circumstances, sometimes due to the relationships they find themselves in. And I think that has been the challenge, that kind of overarches the other issues that I raised earlier on today, why they can't negotiate their sexual practices, or not necessarily can't negotiate, but have difficulty in negotiating their sexual practices and choices that surround that. And even with lifestyle, and even with nutrition, if you look at the cost sometimes just to eat something that is really healthy, and it costs a little bit more than maybe a loaf of bread, and you can feed far more people with a loaf of bread. So then you always have that challenge about finding that balance between what the information is you need that person to know that in order to eat healthily, and what they can actually afford to be able to give effect to that. Yeah. So I'm going to talk about the key health challenges that affect women, and as you heard, I work in the Department of Health, so I'm speaking from that perspective. So the Western Cape Department of Health, we are responsible for serving the uninsured communities, right? So that's people who don't have medical aid. And you'll be shocked to see that that's 73% of the total population. Now, for millions of people, that's a lot of millions of people, right, that we have. Our strategy in the Department of Health, we have every 10 to 20 years, we have a strategy, something that we're working towards. Now, you can all, who of you have ever been in a day hospital or a clinic? A government-run day hospital or clinic, just high up, let me see. Okay, that's roughly 50% of you, right? Now, you've walked into a facility. Who of you have had somebody say to you, wat soek jy vandag? Can you put your hand up? Who's been given a snotty remark ever? Who's been given the bad attitude? Who's been told, alweer jy? Right. Okay. We get the picture. So that's the reason why we've gone for our strategy Healthcare 2030. And the whole idea is that we're moving towards person-centeredness. In other words, putting the patient in the middle of the experience in the facility. Now, this is easier said than done, because changing behavior of staff is proven to be one of the most difficult things ever, right? I mean, you can all think that teaching an old dog new tricks is nie maklik nie, right? But that's what we're moving towards for 2030. It's a long way off, but it's a struggle, and we're getting there slowly but surely. So please, those of you that access our services, use the complaints and compliments box and use it appropriately so we can actually see what's happening. Then our vision is C squared AIR squared. Who did maths on school? Okay. So C squared means we have to be caring and we have to be competent in our jobs. A means we have to be accountable for what we do. I is we have to do it with integrity. R squared, we have to have respect for each other and for our patients, and we have to be responsive. At least when you phone, we must answer the phone, to say the least, right? Next slide. Then Okay, then just to show you what the population looks like. Right, so I see some of my population has vanished, but it's probably compatibility between my computer and your computer. But this is the population of the Western Cape. Now, if you look at the biggest orange section, that is the population in the Cape Peninsula. You know the old Cape Peninsula, right? This is basically where now, if you look at the whole Western Cape and just visualize it, we stretch as far as Plettenberg Bay, and we go all the way up past, I think it's Van Rijn, voorbij Van Rijnsdorp. Yeah, I think we ended Van Rijnsdorp before the Northern Cape starts, right? And basically, what I'm saying to you is that that's the smallest, it's a huge geographical area, but the Cape Peninsula is the smallest within that. So if you can have a look here, you'll see that 64% of that population of the whole province lives in this small, what we call the metro district, right? And those other pieces of the pie basically depict Cape Winelands, West Coast, Overberg, and all of those other areas. So this is where you live, and this is what we have to deal with. Now, if you take 73% of that population, you're looking at more than 3 million people that access health services in our 47 day hospitals, right? And 99 baby clinics. Next slide. Now, you've heard enough about health challenges, but I want to rank them for you. I want you to have a look at it in order. Now, some of the things we talk about more than other things, but just look at it. What is the biggest culprits here? HIV and AIDS. What's the next culprit? Tuberculosis. And after that, all these diseases of lifestyle challenges that Rene has been speaking about earlier this morning. Your diabetes, your stroke, your heart disease, your hypertension, and in the middle between the two is lower respiratory tract disease, which includes those conditions that come as a result of smoking. And then accidents, transport injuries, breast cancer has followed that, and then your lung cancers. So I'm just ranking them for you. Now, this is amongst women, okay? Just bear with me, women. The next slide I'm going to show you, in South Africa, all total, right? This is what it looks like. If you can just keep clicking on the slides. Unsafe sex, again, related to STIs and HIV. Interpersonal violence, alcohol harm, alcohol-related harm, and tobacco. I want to just stop there quickly and just tell you that I worked in an emergency center. And if the patient walking through the door wasn't either assaulted by somebody who was under the influence, was themselves under the influence, then it wasn't a normal night in the EC. I worked at Hanover Park, 24-hour unit, for about 6 years, and I worked in the emergency center most of that time. And I'm telling you that the stats that you heard earlier on in the 6 facilities, it's even, you can multiply that when you're working in the EC specifically and you extract that data just for the emergency center. It looks a lot worse than what you've heard earlier. You can continue. High BMIs, and we know what the risks of that is. Next. There's all again. See, the same pattern popping up whether you look at women alone, whether you look at women and men. Continue. Right, now I just want to show you briefly. This is some of the reality of what we have to deal with. I took last calendar year. Now, the red bar on top is the women, and the blue bar at the bottom is the men. And if you follow me, you'll see that the last 1, 2, 3, the last 4 columns on my side, that constitutes the metro district, the Cape Peninsula, where we live. And if you look at that, you can clearly see how many thousands of women have been started on antiretroviral treatment for HIV. Look at the proportion of men, look at the proportion of women. Those are the real figures. This is no exaggeration. This is no research study. This is the actual numbers at our health facilities. I must remind you, this excludes the 27% of our population that access services in the private sector, because in the private sector there's no HIV. Okay, right. But ladies, please look at this. This is the reality. Now, technically, if you're sitting in any place, you're supposed to be able to go 1, 2, 3 positive, 1, 2, 3 positive, 1, 2, 3 positive. That's what we're dealing with. And then out of 1, 2, 3 positive, you're probably going to count 1, 2, 3, 4, 5, 6, 7 accessing care. 1, 2, 3, 4, 5, 6, 7 accessing care. Do you understand what I'm trying to say to you? So we need to know our status. We need to know whether we have HIV. We need to be able to access care. Next slide. Now, I want to just show you the numbers for sexual assault cases. Over 7,000 women were assaulted in a year, on average, in the Western Cape. Look at the metro, 5,000. These are only the women who come into the rape centers and the emergency centers that say, this has happened to me, I need help. How many other women aren't scared to come to our services? I'm telling you, that number is way below the reality. Now, the question we need to ask ourselves is, why aren't they coming? They're not coming to our services where they're going to get a funny attitude. There's special rape centers, so that can't be the excuse. Women and men trained, mainly women, trained to deal with this. Caring women, counselors, right, volunteers, from be able to deal with kiddies all the way up to any age. So why aren't people coming? What is the intimidation that they're facing in their local communities that prevents them from coming in? What's the relationship like? Is it often someone they know and they don't want to cause family problems because that's the person who works for the family that's caused this and I'm going to destroy the entire family if I come forward? Those are the realities in our society. Next slide. Termination of pregnancy is just another blow away to all of you. We terminate 15,000 pregnancies per year. This is not a funny statistic. 12,000 in the metro. What's going wrong? What are we talking about? Do we address these issues? Is it them and us? Those are the questions we need to be asking ourselves. I'm going to tell you a quick story. At Karl Bremer site, termination of pregnancies. In the last couple of years, you'll get a girl, and this one case is a real case, 16-year-old girl. She's coming with a 6th termination. So like, what have we done wrong? She gets counseling every time she comes. We talk to her. You know, what's going wrong? And you ask her the question, why don't you weep? Give her the injection right there and then. She's covered for 3 months. Not long after that, she's back in with the next termination. Why? She says, my ma gaan my kaartjie kry en sy gaan my doodmaak. Or the neighbor's going to see me go to the clinic for my shot, or the nurse at the clinic's got a bad attitude. But there's some real reason, but the main reasons are, my ma gaan my doodmaak. So she'll rather come in there and have 5, 6 and more terminations, but she's not going to let her mother find out. She doesn't have the freedom to have the conversation with her mother or her caregiver or her guardian about her sexuality choices or what options she has for sexuality, because some of us, we just don't talk about it. You see, it's uncomfortable. We don't talk about it. Can I ask you, be brutally honest, who of you feel totally comfortable, easy peasy, having a conversation about sex? Put up your hand. Okay? You're giving me a good reflection. That's roughly a quarter of us. Okay? And that's okay. That's okay. Because if we can put it on the table, the rest of us can say, it's not comfortable. So how do we need to equip ourselves for it to become comfortable? So we can start changing the tide on pictures like this. Next slide. Right, so what questions does this raise for us as women sitting here today? I've shown you a lot of gory stories. This is not funny. We shouldn't be killing babies. We shouldn't be having so many women raped. We shouldn't be dealing with all of this. And we shouldn't be fueling more and more HIV and people needing treatment, right? What choices are we making regarding our lifestyle is the question to you and myself. What choices are we making regarding our sexuality, and what choices do we really have? Very important. We can make the right choices, but not all women sitting here today even have the freedom to make those choices. Just remember that, because we are caught in situations whereby our choices are determined by other factors. Breadwinner, a man that refuses to wear a condom even though you know he's having an affair and he's sleeping with you too. Where is he using the condom? Where should he be using the condom? And if you tell him to use a condom, he's going to tell you, you're my wife. I refuse to use a condom. Another quick story, a 63-year-old care worker of ours that will develop TB, went for a HIV test as part of what we do when patients get TB, and it's routine, and found out that she was HIV positive after being married to the same man for 40 years. When she went home and spoke to him, he packed his bags and left. Breadwinner walked out by the door. He said to her, you're the one who tested positive, not me. Right? What knowledge do we have, and what do we choose to seek? What lifestyle choices are we making, and what should we make? And you've heard enough of that already, so I won't say more about that, but ask yourself that question. Do yourself the favor, justify why you're here today, and ask yourselves that question, those questions. Next slide. So how can each of us make a difference in all of this? Now, the bottom line is, these are the three terms that I like to use. I say with whatever we face in life, there's this thing called individual responsibility. What do I do? If I'm the person affected, if I'm the person infected, if I'm that person, what must I do? I must take my medication, I must go for my visits on time, I must look after myself, I must eat right. That's my individual responsibility. Now, you can't expect the nurse and the doctor to make sure that you get better when you're not going to take individual responsibility. The second term is family accountability. When my husband, 10 years ago, had extrapulmonary TB, out of the blue. Where's this coming from? Kids were small, panicked a bit. I had this 2 small kiddies, and here this man is ill. I had to become that second label. I had to take responsibility with him. I had to be accountable as a family member and support him and help him get through his treatment. Community awareness, that's you. All of you, what do we do in our communities? How do we make our communities aware? What do we do in the church? But what do we do outside of the church, right? We're the body of Christ, but what are we doing outside of these 4 walls? What difference are we making, and how are we making sure that we pull together to prevent all of these things that we've been talking about today? I challenge you. Next slide. Now, practically, right? Make informed choices. Get the knowledge, get the information. If anybody, if Renee or I or anybody spoke about anything you've never heard about before, find out more. The Bible says, my mense gaan teen gronde weens 'n gebrek aan kennis. Right? My people perish due to a lack of knowledge. There's a reason why that scripture is there. Immunize your children. Screen yourself monthly. Who of you screen your breast every single month? Every single month. Yeah, yourself. Who palpates their breast every single month? Who knows how to do a breast examination on yourself? Who knows how? High up, who knows how? See, we've got to educate ourselves. There's a lot of you sitting here that don't know, and it's an opportunity for us. Regular pap smears, lifestyle changes, I won't go into, you've heard enough about that, but our children. Ladies, our children. If there's anything you heard about here that you don't know about, what are we doing for and about our children, and how we're making sure that they are equipped, right? Then, in conclusion, I want to leave you with this. A wise man once said to me, a woman determines the atmosphere. If you don't believe that, you better believe that. In your home, in your society, in so many ways that. Now, I ask myself and I challenge you all, what atmosphere will you set? What legacy will you leave, right? And what difference will you make? Because I'm not going out here without making some kind of a difference, right? Because I believe that you are God-given, you are God-purposed, so don't miss it. Thank you.
We're speaking to Ivy Meyer, who not only is a dancer, has her own dance school, but is also a businesswoman. Okay, Ivy, you got elected as Businesswoman of the Year, I know that, and also you also do team building and building up of women. So I just wanted you to tell us a little bit more about that and why it's important to build up women in South Africa.
Yes, basically, since I've won Businesswoman of the Year, I wanted to uplift and acknowledge the other businesswomen in our society. So what I've basically done is I do a lot of team building work with people. I do a lot of upliftment and acknowledgement, seeing that the businesswoman of today needs a lot of work and understanding of how to run a business. So we do a lot of those. I've had SARS over to do a workshop with our team, because it's very important to make sure that our businesswomen start at the beginning first, right? And SARS is our number 1 priority. And then obviously with my own business, what I run is a medical and surgical suppliers company, where I deal with doctors and nurses, very specialized items. And I do team building sessions with them where they interact. It's communication, it's teamwork, it's upliftment, so that they can lift the morale of themselves, because they work 24 hours a day with our patients.
Valdi, you work at the Trauma Centre here in Cape Town. Can you tell us a little bit more about the work you do and with specific reference to women?
Okay. I joined the Trauma Centre in 2010, and it's an organization who offers trauma counseling to people who are affected by violence and torture. We started out in 1993. Before that, we were just a group of volunteers providing counseling to mothers, to wives, to women whose relatives had been arrested during the apartheid years. Now, 20 years later, we focus on domestic violence, we focus on intimate partner violence, and of course, beneath all of that, you have other problems like gang violence. So we have women who experience more than one form of violence at the same time. And the challenge we have is that it's not something in the past. You can be raped today, and tomorrow you could be mugged. And tomorrow, the next day, you could be a victim of domestic violence. So it's not an easy process of helping people recover from trauma. It's not about one session and one conversation and then you're done with it. People take years, women take years to restore and heal. And people heal in different ways. So we try to work with a range of models to help women. We do crafting with them so that they can just have a time to relax their minds, process what is happening to them, and really just find their self-esteem, find their worth. You're so broken down by what has happened to you that you begin to believe you're responsible for what has happened. But at the trauma center, we try to help people find their dignity again. This is women. We do everything for everybody. So my 30-second challenge to you. One finger at a time. This week, what have you done for yourself lately? Shall we go 30 seconds? Can you think of one thing you've done? 2, 3, 4, 5. How many of us have done special stuff for ourselves? Where we can say, yes, the kids went off to school. Yes, husband got his lunch. Yes, we went to work. But I sat down and I had that cup of tea. I had that neck massage. I laid in late. We don't take care of ourselves. And as much as I have achieved in life, my busyness is also my enemy. And in my walk now with cancer, because as Juanita and others have said, it's lifestyle issues. I'm having to teach myself to love myself differently. I don't hate myself, but I'm always not kind to myself. And if you're going to journey with cancer, you've got to learn that very, very fast. You've got to learn to work with what you've got. You need faith. If you don't have God on your side, guys, forget it. You're going to buy into all the negativity around cancer. Chemo kills. Radiation kills. Don't tell me that it's the only option I have. I've tried the cannabis oil, and I'm far too high when I'm on it. No ways. I sat in a staff meeting where my lips were swollen and the heads of my staff was dotting all around. Not for me now. But you know, guys, you need to work with your support team. You can have your husband. You can have your family. You can have your pastors. You can have your friends. But what are you doing for yourself lately? And that's my tough journey now. Because ek is besig. I stay busy. Travel the world and I teach and I do whatever and I write. But what have I done for me? And I used to feel so guilty of taking time out for me. And now I say, no, I can. Because that's the change we need if we are going to deal with the issues of lifestyle diseases. So I've had to go back to the books And I've really had to have very deep conversations with God about unlearning some of the bad habits I have in me. How to take time out. I've always joked about sports. I never saw the sense in running and sweating when you can actually read a good book and learn more. And now I have to tell myself, Nico, jy moet maar vir Karen wys, jy moet maar saam met Karen loop. Because in order for the cancer to die out, I cannot have an acidic body. My body must be alkalized. I can't have juices. I can't have that coffee because I still want to write 3 or 4 pages on my PhD. No. I can't have cups and cups of tea. And there's so much acid in my body that the cancer cells divide and divide and divide again. This is our God-given body. And how do we take care? How do we thank Father for this body when we're rushing through life? But I'm telling you, it's a challenge not to rush through life. It's a challenge to actually sit down and have that coffee. Want ek staan in die kombuis, maak ek coffee, then the tap is running, and then I drink the tea. No, you need to sit down and drink the tea. And those are the simple things in life around how we live that we take for granted. We'll rather watch Sewende Laan again. And we'll rather watch the repeats of idols again. How people are mocked. Than to say, let's go to the beach and take a walk there. And those are the things that I'm trying to unlearn. Because I need my body to have oxygen. I need to breathe. I need to eat properly. I need to eat those things that are horrible. The latest is the moringa tea that has far more nutrients than spinach or broccoli. But it's a saak van gebed. But you know what? Life cannot always just be pleasant. Because pleasant is not going to take you where you need to be. And for me, this is what I want to leave you with. What have you done for yourself lately? How are you loving yourself? Put everybody else out. What is your language of love for yourself? What are the things that you liked as a little girl growing up that you no longer do? You had fun doing it. You were a crafty person. But now life is consumed by your children, by your work, by the community. All of those things are important. But we need to have balance. That was the mistake I made in my life. That's the road I want to travel now. And it means relearning, undoing deep-rooted things, deep-rooted philosophies of how a woman should live a life. But we must remember, we are God's creation. And His purpose for us is for us to take care of ourselves in order to show His glory. And so for me, I want to leave you with that. What have you done for yourself lately? Thank you.
Venetia, you spoke earlier today at the conference, and the conference is centered around body, spirit, and soul. And not only that, but you also you work for the Parent Center, you're the director of the Parent Center in Wynberg. And so you know that it's important as parents being the foundation of society, the family being the foundation of society, to build up women. I just want you to tell us a little bit more about the work that you do at the Parent Center.
So the Parent Center is a non-profit organization We're based in Cape Town. We've been going for 33 years by God's grace. And our focus is on supporting parents and providing educational services. So we offer counseling, parenting training, workshops, a teen parent program, home visiting for at-risk pregnant women to prevent child abuse. So it's really about providing support, as I say, for parents because it's difficult. Parenting is tough. Especially today, there's a lot of pressures on parents, there's a lot of pressures on children, and parents need all the help we can get. Yeah.
Wish it could be easy. Why is life so messy? Why is pain a part of us? There are days I feel like nothing ever goes right. Sometimes it just hurts so much. But you're here, you're real. I know I can trust you. Even when it hurts, even when it's hard, even when it all just falls apart, I will run to you, 'cause I know that you are lover of my soul, healer of my scars. You steady my heart, you steady my heart. I'm not gonna worry. I know that you've got me right inside the palm of your hand. Each and every moment, what's good and what gets broken happens just the way you planned. You are here, you're real. I know I can trust you. Even when it hurts, even when it's hard, even when it all just falls apart, I will run to you, 'cause I know that you are lover of my soul, healer of my scars. You steady my heart, you steady my heart. And I will run to you and find refuge in your arms. And I will sing to you 'cause of everything you are. You steady my heart, you steady my heart, even when it hurts.
Lungi, you've spoken about body, soul, and spirit, the theme of today's event here at His People South. And I just want you to tell us a little bit more about why you think it's important, not only the wellness, but uplifting women in society.
Two big topics. I suppose uplifting women in society is important just because women are key. They're the largest part of the population, actually more than men in South Africa. So they're a key resource in society. And I think uplifting them, making sure that they play the role that they play in society to their greatest ability is important. And the mind, the body, and the soul are the key elements of wellness and health. Often most people, when they think of health, they think of just the body, but they neglect the fact that you need the soul and the spirit elements to be well as well in order to have full health and to be able to actually achieve all the things that people achieve. They are very interconnected to each other. So the World Health Organization defines health as this. Health is a state of physical, mental, social well-being, and not merely the absence of disease and infirmity. In other definitions, it includes the spiritual element as well. So when you're healthy, your mind is healthy as well. Socially, you're healthy as well. It's really not just about the body. And we've spoken a lot about the body today, and it's important that our bodies are healthy because they have to carry us through this life of ours on earth. But it's critical that our souls and our spirits are healthy as well. So I'm going to talk a little bit about those two elements. Actually, there have been many studies that speak about how our mind and our spiritual health and our soul health actually also affect our body. You can get physically ill if your mind is ill, if your spirit is ill. The Bible says in Proverbs 17, verse 22, a happy heart is good medicine, and a joyful mind causes healing, but a broken spirit dries up the bones. If we're not well spiritually, we can find ourselves really unwell physically. In the psychiatric ward, part of what you have to do when you're treating depressed patients is you must make them move. You must make them smile. You do all of these things because if your mind isn't well, your body actually starts to shut down and disintegrate as well. And so part of the healing of the mind is so that the body is well as well, and the healing of the body also affects how we do. The second thing that I want to talk about, Valdi spoke about a little bit, is stress. Stress is probably, second to sugar, the next biggest killer for us. Sugar is terrible, and I'm not going to tell you any more about that. You've heard about it. Sugar is terrible. Sugar is terrible. Sugar is terrible. Sugar is terrible. You can get addicted to sugar, and people actually go through withdrawal symptoms when they cut out sugar from your lives. And so I would even dare you to try and cut out sugar for 5 days. Monday to Friday, have no sugar in your tea, no cakes, and see if by day 2 or by day 3, you don't start having headaches and start having shakes. And if you do, your body is addicted to sugar. Not necessarily you yourself in your mind, but your body is addicted to sugar. And that's a problem. So anyway, that was just a side note. Stress is a killer. Stress destroys your body. So one of the reasons why I think God was clever in making sure that we know it from the Bible as well. Do not worry. Worry actually kills your body slowly, literally, not even just conceptually. When you take the body of somebody who's worried and you test the cells, some cells start dying just because of the amount of stress in the body. Valdi made a very good example. Part of why she said the reason why she had to learn how to slow down and not worry is because the cancer cells produce more when she's worried, primarily because your body is abnormal in a worried state. So everything that we can do, please, can we reduce stress in our lives? Can we slow down a little? Just slow down just a little. Just slow down just a little bit. Take more deep breaths, slow down between things. Everything doesn't have to happen today. We've just got to slow down. Stuff is always going to be there. You know, I was saying to the lady sitting next to me that the reality of it is that stuff is always going to come at you. Always. So it's never going to happen by itself. Unless you actively push it away, it's just going to keep coming. And I understand that there are some seasons of our lives that are crazier than others, like when your kids are small. Like, life is crazy during that time, and I get that. But even in those stages, we need to figure out a way to just decompress a little bit. So the massages, all of those things, do them, girls. Do them for each other.